that you joined this webinar. And this webinar is now related to respiratory diseases, its economic importance and control. So everyone knows that in poultry, respiratory diseases have very much economic importance when it comes to the bird's overall health, performance, and productivity parameters. So our objective to conduct this webinar is to aware yourself about the respiratory diseases and how can you manage this economical losses due to respiratory diseases. So today we have a very scholar speaker, Dr. B.C. Dutta, and he's a well-known face in poultry industry. And Dr. B.C. Dutta is providing consultancy through India, Bangladesh, Nepal, and Africa as well. Dr. B.C. Dutta is based at Kolkata, and Dr. B.C. Dutta currently have their own YouTube channel. We call it a Poultry Troubleshooter. And Dr. B.C. Dutta written so many articles on farm management in reputed journals. So I welcome Dr. B.C. Dutta for this webinar as our main speaker. So I request Dr. B.C. Dutta to start this webinar. Yes, sir.
1 minute. Just hello. Good afternoon. Namaste, everyone. And welcome to this webinar on respiratory diseases, its economic importance, and its control. As we, the poultry people, the poultry fraternity, you know, we are facing the respiratory problems every day, whether you have breeder, you have layer, you have broiler. Respiratory problems are damaging our poultry production efficiency every day. We are losing every day. Abnormal respiratory sounds, respiratory diseases, threatening our industry and killing our profit. So we welcome you all. We'll discuss today about the respiratory diseases in general and how can we minimize the losses from these respiratory diseases. Thank you, Chembond, for organizing such a wonderful webinar for the important subject. And Dr. Sanjay is very much known to me. He is organizing all the things. Special thanks to Dr. Sanjay and his team. Let us start today's subject without much waiting. As you know, our subject is poultry respiratory diseases, its economic importance and control. Hope the screen is visible to everyone. I am audible to everyone. Hello, Dr. Sanjay.
Yes, sir, you are audible, sir. Please.
Okay, nice, thank you. So let's see what is respiration.
Yes, sir, please continue.
Let's start. What is respiration? Let us start. Respiration is the act of breathing. The trachea, the bronchi, the lungs allows chicken to breathe. They bring oxygen into the body. It is called inspiration or inhalation, and sends carbon dioxide out. That is expiration or exhalation. This exchange of oxygen and carbon dioxide is called respiration. But practically, respiration is a process in living organism involving the production of energy with the intake of oxygen and release of carbon dioxide from the oxidation of complex organic compounds. That's the actual respiration is the production of energy inside body with the intake of oxygen and release of carbon dioxide. This is not just gaseous exchange, but production of energy for the living being. Let us know about the chicken respiratory system. It's quite similar like mammals also. This nasal cavity, trachea, bronchi, lungs, but the difference, there are few major differences of chicken respiratory system with mammals. Chicken have 9 air sacs through which they can fly. Chicken lungs are relatively smaller and firmly attached to the ribs and do not expand much like we mammals. And birds have incomplete diaphragm. Chest muscle and the sternum do not lend themselves to expand like a mammal's chest and sternum. That is the difference with respiratory system of chicken and with the mammal. Let us know about the functions of respiratory system. As we all know, the gas exchange is the main function. Oxygen from the ambient air is sent for carbon dioxide produced by the cells in the alveoli of the lungs. Fresh air with oxygen is inspired into the lungs through the conducting airways. At the same time, venous blood returning from the various body tissues with high carbon dioxide content is pumped into the lungs by the right ventricle of the heart. In the pulmonary capillaries, carbon dioxide is exchanged for oxygen. The blood leaving lungs with the high oxygen content and low carbon dioxide content is distributed to the tissues of the body by left ventricle, and during expiration, gas with high carbon dioxide is expelled from the body. The second important function of the respiratory system is to maintain the acid-base balance by removing carbon dioxide from the body. The third important function of the respiratory system is phonation or production of sound by the movement of air through vocal cords. Like I am speaking, I am producing sound. Birds also produce sounds. That is phonation. And the fourth important function of respiratory system is pulmonary defense mechanism. Each breath brings into the lungs a small sample of poultry house environment, including microorganisms, dust, litter, toxic gases, and smoke. The cilia and mucous layer of trachea protects the entry of non-desirable substances into the lungs and remove them from the body. During inhalation, the mucus traps the dust, microbes, or other small particles to keep them away from traveling to lungs. Then the smaller hair-like cilia in the trachea move in rhythm to push the mucus out of trachea to expel or to swallow. Is the fourth important function of the respiratory system. And the fifth is pulmonary metabolism. The cells of lungs metabolize substrates to supply energy and nutrients to their own maintenance. Before proceeding for respiratory problem, we must know the respiratory system and their functions. That's why I'm discussing all this. What do you mean by poultry respiratory health? Everyone wants respiratory health in our poultry farm. That's the structural integrity, house environment, and the respiratory disease-free area. The structural integrity of the respiratory organ like trachea, bronchi, lungs, and air cells, and poultry house environments for easy and free breathing of fresh air without any toxic gases or dust or smoke. And the house should be free from respiratory diseases. These birds, the farm with these birds looks like a healthy respiratory situation. Birds can breathe freely, easily. They are either sleeping or playing or eating or drinking. No one is panting or having any respiratory distress in this picture. So everyone wants picture like this in all our farms. Let's proceed for next part. Poultry respiratory health means structural integrity of trachea, bronchi, lung, and air cells. See the normal lungs column, normal lungs, and the normal trachea. We want these in all our forms and normal functioning of respiratory system. These pictures, little disturbed respiratory system, this trachea and the bronchi joint, little congestion is there. And in this picture, you can see the heavily congested hemorrhagic trachea and lungs with pus and mucus. This is the diseased respiratory system We don't want this. We want this as poultry respiratory health. Let's proceed. Next slide. Airway passage is very important for poultry respiratory health. The passage means mainly the trachea. If we cut down the trachea lengthwise, this will be the picture. This is a schematic diagram. See the wall. There are cells, and inside of the cells there are ciliary structure. And next is the gel or mucus layer. And next is the airway lumen or passage through which air passes. These are the gel type structure, and this is cilia. And if we see the electron microscope structure, this is the lumen through her air pass, and this is ciliary structure. And on the ciliary structure, there is mucus. If any foreign particle enters, the mucus traps it, and then ciliary structure move in rhythm to remove them out of the system, either swallow or by sneezing, coughing around system. This is the airway passage that is very important for respiratory. We have earlier discussed about the lungs, the size of the lungs. They are tightly fitted inside the ribs, so they cannot expand like mammalian lungs. But if we consider the efficiency of chicken respiratory system, they are much more efficient than the mammalian lungs. Let's see how the chicken respiratory system functions. Well, we are going to watch a video. Please listen and please see. Look. Okay.
There's severe bronchi and needs, depending on how completed the oxygen has been.
Look. हाँ? साउंड नहीं है, कंप्यूटर साउंड है, लेट इट बी, जस्ट 1 minute, 1 minute. Hello. Hope you understand how the blood is deoxygenated blood when it is coming from the part of the body, getting the oxygen from the inhaled air in the capillaries of the bronchiole. This is just as that I wanted to show that. Now, let's see some more thing. When that's it shows the bird's lungs are much more efficient than we mammalians. That's why birds can fly any height, even above the Mount Everest. There are birds they can fly. Where we used to suffer from oxygen crisis. We need oxygen cylinder there. Let's proceed to next slide. What are the challenges to the respiratory system? Major challenge is the environment, because poultry house environment contain dust, microbes, litter material, toxic gases, always present, and they are posing threat to the mucous layer and ciliary structures. For your information, 1 gram of dry feces may contain 1 million E. coli. 1 million means 10 lakh E. coli in 1 gram of feces. Total bacteria in poultry litter were detected by culture at 10 to the power 9 CFU per gram, means 1 billion CFU per gram of material. 1 gram of poultry litter can have 100 crore bacterial shape culture. This is the situation. Now, the microorganism of all respiratory infections like E. coli, Mycoplasma, Coryza, RD, bird flu, IB, pox, laryngotracheitis, hypopericardium syndrome, or spread through droplet or dust in the poultry house. In poultry farming, chicks live in as a community where horizontal spread of microorganisms by direct contact or through airborne droplet on dust from sneezing or coughing of birds is a continuous process. Because when the birds are sneezing or coughing, the minute droplet of water, it comes in touch with the dust, and the dust are moving inside the poultry house. And when the birds inhale, they inhale the dust with the infected microorganism. That's why how the horizontal spread of infection from one infected bird to others happens. It is continuously happening in poultry house environment. Moreover, toxic gases like ammonia destroys the cilia and opens the door for dust and microbes to the lungs. Other challenges, as we have already discussed, the anatomical structure of the lungs. It is smaller and cannot expand, it's tightly fitted, so that's a limitation, that's a challenge. One more most important challenge. There are few infections, the most notorious infection you know, E. coli, ranicate, and avian influenza bird flu. They enter the chickens to mouth, produce a disease, produce a septicemia, then transit the travels to trachea, lungs, and bronchi where they produce diseases. They do not enter through respiratory system, the nose. They enter through mouth, but produce a disease in the respiratory system. That's a challenge because birds are always eating this litter and other materials, so they are taking the infection, and that is a challenge to respiratory system. These are the challenge to respiratory system. Let's know the causative factor of respiratory infections. The predisposing factors. First is the predisposing factors, which invites other disease by creating favorable situation like destroying the cilia and mucus. They open the door for respiratory microorganisms. In respiratory infections, there are dangerous diseases of bacteria, virus, mycoplasma, and fungus origin. We'll discuss later one by one. And then the aggravating factor. E. coli, as we know, is ubiquitous, everywhere present, and present in all our poultry area. Both E. coli and mycoplasma are opportunists, and they wait for the favorable situation. When the other respiratory diseases comes, they aggravate the situation by causing, suppose in case of mycoplasma, later E. coli came, we say CCRD. This E. coli and CCRD aggravate situation. So whatever respiratory problem we are seeing, we have to consider all these three predisposing factors, respiratory infections, and the aggravating. Let's know what are the predisposing factors of respiratory disease. Litter material, dust, feather particle, pollens, all are the predisposing factor for respiratory disease. Then smoke or carbon monoxide, pneumonia, heat stress and chilling. Then poor ventilation, overcrowding, wet litter. All these are predisposing factor, means they are causing the early damage, opens the door for the respiratory infective bacteria or virus enter and produce disease. Because all these causes damage to the respiratory tracheal cilia and mucous layer. We have to consider. Then what are the respiratory disease we commonly encounter in our poultry? Bacterial disease like E. coli, infectious coryza, owl cholera. Mycoplasmal disease like Mycoplasma galliseptica, Mycoplasma synovium. Fungal disease like Brudan pneumonia or aspergillosis. And there are many viral diseases like Ranikhet or ND, avian influenza, bird flu, infectious bronchitis, infectious laryngotracheitis, owlpox, and swollen head syndrome. These all are poultry respiratory disease. They are challenging us every day. Let us discuss in short about all these diseases. First is Ranikhet or Newcastle disease. ND is the most dreaded contagious viral disease of the globe, causing huge loss every year. ND can be acute lethal, causing heavy mortality in any age, or maybe mild or asymptomatic, causing respiratory signs but with poor productivity. Disease mostly enters through nose, mouth, eye, and transmits through direct contact via aerosol or through contaminated feed, water, equipment, and human clothing. ND virus can survive in dead birds for several weeks in cold weather, several years if kept frozen. Virus can survive in contaminated feces at 37 degrees centigrade temperature for over a month. The poultry fraternity present in this webinar, I request you all just consider this point. Ranikhet virus can remain infective at 37 degrees centigrade over a month in poultry litter. So, cleaning and disinfection of poultry premises after any viral infection is very, very important. When the litter materials, the feces are lying beside the farm, it is heavy risk. Anytime it can cause further infection in the next crop. So consider this point. Ranikhet virus is very active. Symptoms include dullness, inactivity, hardling at any age, poor feed intake, poor body weight, and poor egg production, respiratory distress, labored breathing, water discharge from mouth, nose, head swelling, closed eyes with conjunctivitis, dehydration, enteritis, paralysis, fever, shivering, and mortality up to 100%. This is a typical example of Ranikhet. It happened last year. I have seen in a closed EC house with 14,000 birds. It was on 24th or 25th day. Every day there was 4 to 5% mortality. You see the condition of the birds. How is the litter? How is the birds? All the symptoms are mentioned here. If you watch the full video, you'll find everything. How the birds, they are unable to stand, unable to move. At this age, they are hardly near little heat source, below the bulb. They are hardly still at this age. No one is taking feed or water. See the condition of the head swelling, eyes are closed. See the condition of the bird, the eyes. I'll take some fast forward. I'll try to show you the respiratory distress. How the birds are taking the breath, they are unable to breathe. That I wanted to show you. Just see the condition of the birds, how it is taking the breathing. The laboratory test confirmed the presence of ND. That's why ND or Ranikhet. That's why I'm confirmed saying it is Ranikhet. Ranicate disease can be controlled by two means. One is strict biosecurity and scientific vaccination program with local data. But together, only biosecurity will not do, only vaccination will not do. You have to do both with scientific data. The next disease I want to discuss is avian influenza or bird flu. It's a very fatal viral disease of poultry with extremely high mortality. Fecal-oral route is the most common, shedding of virus through feces, saliva, nasal, and eye discharge. Poultry traffic means the people who are traveling from one farm to another are the main reason. Migratory birds and the chicken vehicle are the main source of disease transmission. So while visiting one farm to another, everyone should take 100% caution. There are two major types of bird flu. Avian influenza is HPI, which causes almost 100% mortality in 5 days, and LPI, causing slow mortality with respiratory problem and inviting secondary infections like E. coli, CRD, and others. Symptoms are coughing, sneezing, gasping, rales, head swelling, discharge from mouth, eye, and nose, blue discoloration. This is pathognomic symptom, blue discoloration of sand, foot pad, and green diarrhea, prostration, and death. Biosecurity is the only way to minimize loss from bird flu. You cannot control easily, but you can minimize the loss through biosecurity. Then, infectious bronchitis. Another disease is acute, highly contagious respiratory disease of chicken, infection by conjunctiva or upper respiratory system. Incubation period is 18 to 36 hours, means disease can be produced within a day. The infection is very rapidly spreading very rapidly through direct contact. Fomites and aerosol, poor ventilation and overcrowding are the predisposing factor for IB. The symptoms are depression, hurling near heat source, tracheal drains, coughing, sneezing, gasping, watery eyes, nasal discharge. See the typical symptoms of infectious bronchitis in chicks. Mycoplasma and E. coli aggravates the situation of IB in most cases. Control of IB can be done by biosecurity and vaccination of breeder and broiler both. Let's do the next slide. Is the fowl pox, or everyone say pox. Fowl pox is a slow spreading viral disease of chicken characterized by lesions on the unfeathered skin areas and mucous membranes. Two types of fowl pox commonly occur in chicken: a dry cutaneous form and a wet diphtheric form. This is called dry cutaneous form. Dry pox is most common. Lesions are small wart-like growth on face, wombs, wattle, eyelids, skin, legs, and feet. A gradual increase in size, color changes from light to dark brown, and roughened, dry scabs. These scabs usually last for 2 to 4 weeks. After they drop off automatically. These dry scabs contain huge pox virus and are the potent source for horizontal infections. Pox is a self-limiting infection, and treatment is primarily supportive care. Antibiotics may be needed if secondary infection develops. Vaccination is the way to prevent losses in breeder and layer along with biosecurity. This is all about pox. Our next slide is aspergillosis or brooder pneumonia. Brooder pneumonia is a fungal respiratory disease of chicks during brooding time. High mortality rates can be seen in chicks and ports that inhale large number of spores during hatching or placed on a bedding contaminated with more spores. Clinical signs are dyspnea, labored breathing, inhabitants, fever, emaciation. You see the typical, this is typical sign of Buddha pneumonia, this like panting. Unable to breathe, is panting. This is typical sign of Buddha pneumonia. And on postmortem, typical poppy seed like yellowish green or whitish seizures nodules in lungs and sometimes in the trachea, syringe, liver, intestine are found. This is on postmortem, this type of poppy seed like nodules are found in the lungs. Mortality usually continues till the lifting date because ascites and CRD are common after Buddha pneumonia. This is all about Buddha pneumonia. Let's go to the next slide. For colibacillosis or E. coli infection. It is one of the most commonly occurring and economically devastating bacterial disease of poultry worldwide. I don't feel there is any poultry without E. coli. E. coli infection caused by avian pathogenic E. coli. It may be localized or may be symptomatic. Diverse manifestations like acute fatal septicemia or subacute pericarditis, ascites, salpingitis, peritonitis, cellulitis. Signs are non-specific. The symptoms are non-specific, vary with age, organ involved, and concurrent disease. Young birds dying with acute septicemia have very few results, except the enlarged pale liver and spleen, increased body fluid. The survived chicks develop subacute fibrinoprolin ascites, pericarditis, and perihepatitis. Sporadic lesions of pneumonia, arthritis, osteomyelitis, peritonitis, salpingitis also seen. Control of E. coli is very, very difficult, but strict biosecurity and avoiding stress, dust, and immunosuppression are the keys. To control E. coli infection, you have to avoid all type of stress in chicks, dust in the poultry house, and any type of immunosuppression you have to avoid, and strict biosecurity only. Let's close the E. coli and proceed to next. Infectious coryza is an acute upper respiratory disease of chicken caused by Avibacterium paragallinum. Usually breeder and layer are most susceptible, but broiler after 5th week, maybe infection may come. It's abrupt in onset. Chicken showing sign within 24 to 72 hours of getting infection. The typical symptoms are facial swelling, this type of facial swelling, and sinuses with a clear discharge, with discharge becoming purulent and foul smelling. Males have swollen waters. Marked conjunctivitis, eyes partially closed due to excessive discharges. Early antibiotic therapy is effective in infectious coryza. Prevention is the key to control. All in all out system and biosecurity practices are important. Vaccination of breeder and layer is effective to control infectious coryza. Let's proceed to next slide. This mycoplasma or CRT. We all are very much concerned about CRT. Every day we are listening the name of CRT. Mycoplasma gallisepticum, Mycoplasma synovium, and Mycoplasma meleagris are the causative organisms. Infection spreads both vertically and horizontally. That's why control of CRT is very difficult because it is a maternally transmitted disease from mother to chicks. Once infected, the chicken remains so until death and act as a silent carrier. So just think, if a breeder flock is infected, if you give treatment, there is temporary, you get relief, temporary mycoplasma will not be seen, but the parent birds will remain infected for their whole life and the eggs they lay will carry the infection for the progeny continuously. Mycoplasma only lives 5 days outside the host body, but may survive longer if protected by exudate and or cold climate. Mortality usually low, but the productivity is heavily impacted, whether it is body weight in broiler or egg production in layer, and egg production or hatchability in breeder is heavily impacted by Mycoplasma infection. Symptoms are sneezing, coughing, head shaking, rales, gasping, discharge from eyes and nose, head swelling, reduced growth, poor egg production, poor hatchability. Mycoplasma is sensitive to most antibiotics, and infection can be controlled temporarily. Control of Mycoplasma involves control of vertical and horizontal transmission. That's why it is very difficult, because culling of parent flock is almost impossible. Mycoplasma control in broiler involves chicks from Mycoplasma-free parent and hatchery. Is a daydream in country like ours. And all in all out system, anti-point biosecurity, traffic control, dust control, and set to set distance. So Mycoplasma control, how much difficult is just understand. Mycoplasma free chicks, because if breeder flock is infected, it remains infected for the life. So chicks are coming with infection inside. Under favorable condition, Mycoplasma produces disease. Moreover, all in all out condition is must anti-point biosecurity, poultry traffic control, at least farm to farm visit, it needs 3-day control, 3-day gap. It's not possible in contact farming irrigation. Dust control, set to set distance. All is a problem in our day-to-day poultry. So Mycoplasma is everywhere. We are facing the challenge. Let's say all the symptoms of all respiratory disease. This is differential diagnosis of respiratory disease from symptoms. All the respiratory disease we discussed: Ranicate, bird flu, IB, ILT, pox, E. coli, coryza, CRD, and Buddha pneumonia. And these are the symptoms we find. So which symptom, where it is available, through that we can have preliminary diagnosis. Suppose in a farm, mortality is there, we are visiting, we are seeing head neck twisting head neck, along with green diarrhea. Oh, let us observe. Where is the green diarrhea? Green diarrhea is present in ND, Ranicate, AI, E. coli, coryza, and CRD. Okay, so it should be out of these 5 infection, maybe one. Then head neck twisting. Head neck twisting is present in Ranicate and aspergillosis. But in aspergillosis, there is no green diarrhea. So this is a case of Ranicate. Head neck twisting along with green diarrhea. Like this, if we consider all these symptoms, we can have a preliminary diagnosis from this table. This table, I made it after my 18, 19 years working in the field. I just made this table. This is available online. So let's proceed to the next slide. What are the losses due to the respiratory infection? The losses due to mortality in infections like bird flu, Ranicate, aspergillosis, E. coli, CRD. Losses due to poor productivity in CRD, E. coli, pox, coryza, ILT, IB. Where in broiler there is poor body weight, poor FCR in layer. Loss of egg production in breeder, reduced egg production, and very low hatchability. So there is heavy productivity loss. Moreover, there is some more loss on medicine expense, and loss of excess manpower. Sometimes to destroy this mortality, we need excess manpower. So that is also due to respiratory disease. We have many types of losses just watch this type of losses. Now we have discussed about respiratory disease, the predisposing factor, aggravating factor. Now we'll discuss about the respiratory distress or problem. What is respiratory distress or respiratory problem?
Sir, you are on mute.
A condition when chicks are unable to breathe freely because of internal or external factors is called respiratory distress, or we commonly say it is respiratory problem. What are the most commonly internal factors? Is obstruction or structural damage in respiratory system due to inflammation of trachea or bronchi by toxic gas, smoke, or dust or infectious organism. The other important internal factors is inefficiency of the respiratory organ due to damage caused by infection, toxic gas, or smoke. As in case of pneumonia, when lungs are damaged, they are unable to breathe in the respiratory distress. The external factors mostly the management inefficiencies and mistakes like poor ventilation, high liter ammonia, overcrowding, chilling, high temperature, humidity. It is management mistake which we can overcome easily. The symptoms of respiratory distress, which so far we have said, in short is runny watery eyes, swollen sinuses, nasal discharge, wheezing, sneezing, gargling, rattling, gasping, and mortality. This respiratory abnormal sound, swollen head, discharges from the nose, eyes, and mortality is the respiratory problem. We want to minimize the respiratory distress or free breathing of the birds. So what to do? We have to, what are the predisposing factor of respiratory problem? We need to remove all the predisposing factors. Whether it is litter, dust, feather, pollens, we have to minimize, or if possible, we have to remove all the predisposing factor to minimize respiratory distress. The respiratory disease, we have to control all the respiratory disease to minimize respiratory distress to the birds. We have discussed already the respiratory disease is bacterial, viral, fungal, and mycoplasma origin. We have to control all the disease. How to control? You have to control all the respiratory disease through vaccination, whatever available, or in case of infection, immediate and best possible antibiotic treatment, along with best possible antibiotic treatment in case of bacterial and mycoplasma disease, and supportive treatment with immunomodulator. There are two types of immunomodulator. One is beta glucan type, one is vitamin E selenium type, like Chemcell AC Bio. You have to supplement multivitamin support, especially vitamin 83C, which are anti-stress factor, like Previte 83C. And the most important supportive is bronchodilator. Nowadays, there are a lot of products with menthol, mint, which are acting as bronchodilator. Means they help the bronchi to dilate so that the respiration will be little easy. They reduce the mucus production in the trachea.
Dutta sir, your
Yes.
PPT is not moving.
Which is not moving?
PPT slides.
Is not visible now?
Visible, but it's not moving.
Okay, now it is I'm not moving. It's fixed
Okay.
on.
Okay.
Supportive bronchodilator is with menthol and mint. They help ease respiration. They are very effective. Nowadays, a lot of products are available. Example is Eucamin. So this is all about how we can reduce the respiratory distress from our chicken. So, at the end of the day, what do we mean by respiratory health? Respiratory health for optimum performance from our broiler or layer or breeder farm. So, what is the take-home message from today's discussion? For respiratory health, we need structural integrity of respiratory system. Structure should be absolutely normal. Protection of birds from predisposing factors to good farm management. Protection from respiratory disease through biosecurity and vaccination. In case of disease outbreak, immediate treatment with or without antibiotic as per the situation, but compulsory with supportive immunomodulator and bronchodilator. This is all about today's discussion. Thank you, everyone. Thank you, Chembond, for all this.
Yes, sir. Thank you for this nice presentation. Now I will open the session for queries, sir. If anyone have queries, please ask to Dr. B.C. Dutta.
Anyone can ask any language, English, Hindi, and even from Bengal, anyone can ask, anyone or Bangladesh. If you want to ask in Bengali, I can answer. Other may not, but I can answer.
Yeah, Madhuswami.
Let's see what are the questions.
Yeah, please.
Hello.
Yes.
Hello, this is Dr. Aruna here. I am from Chembond R&D Biotech Division.
Nice to meet you.
Yeah,
Please.
good afternoon, doctor. Yeah,
Good.
nice. It was a wonderful presentation, doctor. Just we wanted to have a small, like we had a small query that these products like Yucca Mint, like we now it is a like a liquid product. So we give it through, I think it is administered through water and all to the birds. So how, in what way? I mean, it will go through the, it will be swallowed by the birds, right? So
Yeah.
how, what could be the mode of effectivity and all? We just wanted to know for our knowledge, like how it affects the birds.
Yeah.
And
See the product, how it is effective. I think you know better than me because you are the owner of the product. But, I used to prefer oral at the same time spray, heavy spray of this product directly to the birds, so that they inhale the menthol or mint, as like when we use this Vicks or some type of product, we directly we inhale the thing. So it is. I prefer it as a spray, heavy concentrated spray directly to the bird. Not too much dilution like 5 ml in a liter, not like that. Concentrated spray directly to the birds. It gives relief.
Okay.
That's my personal experience only as a field veterinarian.
Okay. Okay.
Any question from the participants? किसी के पास कोई भी क्वेश्चन है इस सब के बारे में? We have some time. हमारे पास समय है, कोई भी इस सब के बारे में फील्ड एक्सपीरियंस के ऊपर क्वेश्चन पूछ सकते हैं from anywhere.
Sir, Dr. Mahesh Chirag is asking what are the typical factors responsible for respiratory distress?
Yeah, what
are the physical factors responsible for respiratory distress?
All the predisposing factor I discussed, they are the physical factors. Mostly are dust. See, when one bird is infected, it is respiratory problems, so it is sneezing or coughing. The minute droplets, while sneezing, minute droplets are in the air. They catch all the dust in the air. So with that air, the minute droplets are flowing inside the poultry house environment, that causes the infection. So this mainly the dust, poultry litters, feathers, these are the common problem. And in open pond, pollen, especially in this season, in the spring, one of the reasons of CRT is the dry weather. The dust are there everywhere, and the pollens from the surrounding area, they are very dangerous. And during brooding, the smoke because of carbon dioxide that causes damage, and the ammonia, the most notorious, most unseen notorious enemy in poultry.
Sir, the next question is from Sunil Kumar Nayak. He's asking, can we go for tiamulin 10% and what dose for CRD?
Tiamulin 10%, yes, you can go, but if you are in broiler, you have to confirm and whether there is salinomycin present in feed or not, and that is very difficult to know because no feed manufacturer will share their anticoccidial program. So tiamulin, use of tiamulin with salinomycin is not advisable. That's why today there are so many salts other than the old tylosin, now tilmycin, tilvalocin, there are many salts. You can use 20 mg per kg body weight continuously 3 days. And along with, if it is along with tetracycline, maybe 1 gram per liter of water will be helpful. Is it for broiler or for layer? He is asking.
Commercial broiler.
Commercial broiler only. Then go for if it is a infection, go for tylosin along with tetracycline.
Sir, Yan Sivaraman is asking, during AI, can we use antibiotics and which disinfectant can we use?
During AI,
Avian influenza, I think he is.
avian influenza, see, it is only God can save you. There is no medicine. If it is a low pathogenic avian influenza, you just try to check the horizontal infection by spraying good disinfectant inside and use immunomodulator to improve the immunity of the birds, and multivitamins like vitamin A high doses, and maybe some liquid amino acids, liquid amino acids with high dose of liquid vitamins, and as a support because it is taking less feed. Liquid amino acid for protein, liquid vitamins high dose, especially vitamin A, and immunomodulator through water, and disinfectant spray to control horizontal infection. Nothing else. Because an antibiotic is not advisable.
Okay, sir. Dr. NV Rao is asking, can you throw some light on AMPV infection?
What?
AMPV infection.
AMPV means what you? Cannot see. I'm not AMPV. What do you want to?
Okay, sir. NV Ramarao, sir. Please share us the full
These
form
are
of
difference in
AMPV.
IV and Buddha pneumonia.
Yeah, maybe.
See, Buddha pneumonia, there is no actual treatment, only supportive treatment or antifungal drug you may give, but it's very much, it will be, there will be great loss because every day there will be mortality after Buddha pneumonia. Ascites and CRDs must. So Buddha pneumonia, you have to control it. Mostly the fungus infection in hatchery or during transportation, maybe the old newspaper or the brooding, the litter material during brooding. You need to control the source of fungus from there. Maybe by copper sulfate spray or some antifungal drug spray. And for IB is biosecurity and vaccination of breeder and broiler. But IB is very frequent. You can have IB vaccination on day, even in broiler, 0 day, while you are releasing chicks, the big dipping vaccination of IB, constant, either suppose you are giving MA5 on while big dipping, then on third day you give ND plus IB vaccination. So that IB will be IB H120. And while giving ND booster on 19th or 20th day, you again give ND plus IB. Is in a IB prominent area where IB is very frequent, endemic zone. You give 2 IB strain vaccine and 3 dose, means IB H120 twice and MA5 once. It's possible, people are doing. I'm Impulse in Bait Company.
Sir, one question is from Nepal.
What is Poland? Poland is the someone is the
Yeah, please. Please, sir.
okay. Please tell me.
The question is from Nepal. He would like to know about chances of recovery in egg production in layers and breeders following low pathogenic avian influenza infection. Is molting a wide follow in such case? Dr. Vivek from Nepal is asking.
Oh, Dr. Vivek is there. Hi, Vivek.
Yeah. So he's asking whether egg production recovery is there possible.
Yes, egg production recovery is possible, not up to the full extent, but suppose 65% recovery means, suppose your production was 75% when you when the infection came, you can go up to 60% egg production by supportive treatment. Long supportive treatment is required, like vitamin A therapy continuous, starting with 3 times dose, maybe 15 to 20 ml per 100 birds, and gradually reducing to 10 ml, then to 5 ml per 20 days. Liquid amino acids, multivitamins, liquid amino acid in double strength, and in the feed also give vitamin AD in double dose for a month. After doing all this, you can get rid of the production. You can recover the production up to 75%. I've seen in Nepal also.
Okay, sir. Utpal Sakia is asking if a layer flock infected with both mycoplasma and IB infections, what should be the line of treatment for that flock?
If mycoplasma is confirmed, then give some good antibiotic. Mycoplasma and IB in layer flock. I'll suggest to give, if possible, in layer flock. If it is a small flock, tetracycline injection is also very effective. Otherwise, tylosin and tetracycline treatment. Tylosin 20 mg per kg body weight once daily, followed by 8 to 10 hours tetracycline 1 gram per liter for 4-5 days. And along with supportive treatment with high dose of vitamin A, multivitamin, and liquid amino acids, because it needs protein.
Sir, the question is there, Fazifur, that without antibiotic, respiratory disease control is possible?
See, if it is bacterial or mycoplasma origin, you have to go for antibiotic. And if it is if you are sure it is a viral, don't go for antibiotic. It's mostly not needed. Only after 4-5 days when mortality is controlled. But if you are seeing E. coli, then antibiotic is required. In case of, suppose ND has come in a vaccinated flock, ND came, it causes minor, maybe mild NB, causing 0.5%, 1% mortality for 4-5 days. Mortality control. Then you see mycoplasma and E. coli. At that time, you can give antibiotic. Otherwise, no need to antibiotic, only supportive therapy. Immunomodulator, liquid amino acid, multivitamin, especially vitamin A in high dose, in layer and breeder.
So thank you, sir, for your answers. and thank you for the delivering such a nice seminar, webinar, sorry. So, sir, just a part of product introduction. I just want to take 5 minutes.
Sure,
Okay.
sure.
Then we'll do another session that my doctor will deliver a speech on vote of thanks. But before that, I just want to take 5 minutes on my new launch. Okay, sir.
Sure.
So thank you all for your presence in this webinar. So in the event Poultry India Expo, we launched this product. We called it as Eucamint, and is a rich blend of essential oils, and it is specially made for giving natural protection to the birds against respiratory illness. So as Dr. Balai Dutta, explained how these 3 systems are very important to provide the protection to upper respiratory tract. That first one is mucus, second one is scavenger cells, third one is respiratory epithelium. So the function of mucus, that it is a sticky substance which is produced by specialized cells in the nose, sinuses, mouth, pharynx, trachea, and lungs. It traps dust, pathogen, and foreign particles. There is a disturbance in mucus production. This respiratory bacteria and viruses, they get easy entry to the respiratory system. These are the scavenger cells. They are the mobile scavenger cells that serve to engulf foreign particles in the lungs, such as dust, bacteria, and carbon particles as well. So the protection, the health of scavenging cells is also very important. The cilia, which are we call it as a teeny structure that have the shape of small hairs, like small hairs. They move continuously in the direction of the beak and carry away the mucus that contains dust, pathogens, and foreign particles, and expelling them outside the body. So the health of cilia is very important, but in the respiratory infection, the health of the cilia disturbed. Because of that, foreign particles enter into the system and they causes the infection. So this is the pictorial diagram that showcases the ciliary movement. This is ciliary movement, and which is a normal movement, and it is very important. But if suppose the cilia health is not proper, this movement is not frequent, or it is slow down. So because of that, it is they are unable to expel the dust or particles outside the body. So if it comes to the upper respiratory tract, if there is a malfunctioning of these 3 functions, so it leads to accumulation of pathogens and foreign particles in the respiratory system that damages the cilia, and it leads to respiratory distress. And finally, that respiratory distress leads to the respiratory infections. So you can see this is the normal cilia, and that other picture showcasing the damaged cilia structure. If the cilia is damaged, there is an easy entry for foreign particles and infectious agents as well. So in poultry shed, there is a common problem of ammonia production, and due to that ammonia production, there is a negative impact on respiratory health. So if there is a 10 ppm concentration of ammonia is there in the shed, it damages the health of cilia. And also if there is a 25 ppm of the ammonium concentration in the shed, it leads to air sacculitis. And if it comes to the 40 ppm of the concentration of ammonia in the cell shed, the cilia gets destroyed. So excess mucus production is also responsible to slow down the movement of the cilia. We call it the ciliary frequency. There are other agents like bacterial diseases. So these bacterial diseases are one of the causes of disturbing respiratory health. So these are coli bacillus, infectious coryza, and foul cholera as well. There are some viral diseases like infectious bronchitis, Newcastle disease, avian influenza, and ILT. These are also responsible for respiratory distress. So we launched the e-comment that contains the oils, and these are all essential oils. So eucalyptus oil is there, peppermint oil is there, menthol is there, calamus oil is there, sage oil is there, lavender oil is there, and thyme oil is there. These essential oils have positive impacts on the bird's health and overall performance of the respiratory tract. So these essential oils performs various functions, like they act as antimicrobial agents. They are immunomodulatory effects. They are having immunomodulatory effects, and they are acting as a antioxidant as well. So there are multi benefits of using these essential oils, but the main benefit is they provide the they provide the positive effects on respiratory health in terms of maintaining the ciliary frequency. Okay. So the e-comment is a natural solution that restores the respiratory functions. So it is effective in respiratory blockages and breathing problems. It is an anti-inflammatory, and it also helps to smoothen the respiratory tract. It ensures the relief from pain. It stimulates air, feed, and water intake. So this product is safe in drinking water, as there is no withdrawal period for this product. So the recommendation for this e-comment is to control respiratory symptoms, or you can use it during the outbreak of CRD, infectious coryza, and other respiratory diseases. Also, to overcome post-vaccination reactions like live NDV vaccinations, you can use this product. So to prevent and treat sneezing, coughing, and labored breathing, that is because of infectious and non-infectious origins, you can treat it with the comment. So there are a dosage and feeding direction. So you can use the comment at the dose of 10 ml for 1,000 birds twice daily. Okay, twice daily. So twice daily usage is recommended if suppose you are giving early in the morning before 8 o'clock, that is a suitable period, and in the evening you can give it after 7:30 p.m. So you can prepare the stock solution of e-comment. You can prepare a solution of 10 ml of e-comment and 500 ml of warm water. Okay, so this solution is then you added to 40 liters of drinking water. So this solution is sufficient for 1,000 birds, and you can spray this in presence of birds as well. So they sneeze, and they with the help of nasal inhalation, they take this e-comment, and there are benefits that actually prevent the dyspnea in the birds due to various reasons. So this is e-comment, which is which helps to naturally restore the respiratory functions, and this product is available throughout the India. These are the details. So for South, we have a zonal manager, Mr. Irla Livria. So in South and West zone, is responsible for the sale. For North zone, Mr. Rajesh Bis is there, who can fulfill your requirements. And for East, Mr. Somnath Banerjee is there, who will help you to get this product. And we have a technical team with me. Dr. Rakesh Tiwari is there, who is responsible for North and East market to provide the technical services and addressing your queries related to our company products. Dr. Nilesh Dore is also there, who is covering South and West, and he is also responsible for providing farm-based services and your queries related to our products. So Chembond is an NSE and BSE listed companies. So we are operating in poultry, aqua, and dairy as well as, and we have, when it is come to poultry, we have all the products which is required for manufacturing the poultry feed, and also to prevent and treat the diseases of poultry. So this is all about today's webinar and our solution for respiratory health, that is e-comment. So my sincere thanks to all of you. So now I would invite Dr. Rakesh Tiwari to give vote of thanks to Dr. Balai Chandra.
Dr. Rakesh is not visible.
Yeah, I think he's not visible. What is the problem? I don't know. But yeah, thank you, Dr.
Others can manage. Dr. Aruna or someone, others can manage. Let them give the vote of thanks.
Yeah. So
Yes, thanks a lot, doctor. And thank you, Dr. Gapat, for sharing the link and the information so that it would be very valuable to us. Yeah, thank you.
Thank you. Thank you, everyone. Thank you, Sanjay.
thank you, sir.
So wonderful time we spent for 1.5 hours to the industry for people. Thank you, participant, and living.
Thank you, sir. Thank you.